Welcome to Body Ecology Living Podcast. I'm very excited about today's talk. I think it's a talk that you're absolutely going to want to listen to, but also share with a lot of other people, because there's this big mystery right now where everybody's wondering what's going on with this new condition called the long haulers or long COVID. And it seems to be another pandemic that's come from having COVID. An enormous number of people who really didn't even get sick with COVID, maybe were completely asymptomatic, didn't even have many symptoms, and all of a sudden now their life is pretty much ruined. So I have a lot of questions to ask Dr. Neil Galland. I'd like for you to, first of all, know that his website is drgalland.com, and he has amazing information on there. It's the most comprehensive information I've found, and I'm always on top of this topic. He talks about the virus, COVID virus, and what's really going on with the ACE receptor. You'll be surprised to learn that it's not what everybody thinks. And he also, goes into long COVID and how to treat that. So Dr. Galland, I just want you to know that you're an amazing person. I've known about you for 30 something years, because when I got started and was so sick myself, and started helping people as I began to learn things, you were the doctor whose name came up over and over and over again. So you were the first part of a group to start functional medicine. So everybody that's listening, we are in the presence of a real giant, really. So thank you so much for agreeing to do this podcast.
Well, Donna, thanks for having me on to share what I've learned with your audience. I've been studying COVID-19 since January of 2020, when I realized this is going to be international. It's not staying in China. And in March of 2020, when the receptor for the virus was identified as being a vital enzyme called ACE2, I realized that everything that I had learned about SARS, which was the virus, the human pathogenic virus that was closest to the virus causing COVID-19, was likely to apply to this virus. And that has really been borne out over the past 19 months, in my experience. In understanding why people get sick, and also in understanding the long haul COVID syndrome. And COVID-19 itself is a very complicated infection. The immune response to it in particular is very complicated. And that's one of the things that has made it challenging. The long COVID syndrome is turning out to be equally as complicated. There are multiple factors, and it's like peeling the layers away on an onion. Although there are certain things that happen which are at the core of both COVID and long COVID.
Well, could we start off, because I learned from your website something I didn't know, because the media certainly isn't telling us, and I really hadn't read it before, about the ACE2 receptor. That I knew about the gene. I actually am one of the many people who have a variant in that gene. I know it makes people salt sensitive, for example, and it puts you at risk for hypotension if you don't take care of yourself. So this was really interesting when I heard that, this virus was using this ACE2 receptor to get into the body. And it sounded like the ACE2 receptor was a bad guy. And from you, I learned that ACE2 receptor is really the victim, not the villain. So, and then you really have an amazing understanding. So if you don't mind starting there, just to give people a sense of what we're talking about here.
Right. So ACE2 is a vitally important enzyme for your health. It's present in many cells. Its effects are anti-inflammatory. It improves circulation. It inhibits blood clotting. It enables recovery from very many types of stress and injury. It is one of these counter-regulatory enzymes that you need when your body is under stress. And it's especially important in blood vessels. and in the kidneys. There's a lot of ACE2 in the nose. There's some in the lungs. But even when there's not a lot of ACE2 present in a particular tissue, the effects of ACE2 activity really can enable healing in that tissue. So it enables recovery from the acute respiratory distress syndrome, which is one of the things that kills people with COVID-19. So the SARS virus, which was really scaring us in 2003, 2004, used ACE2 as a receptor, and the people studying SARS realized that one of the effects of SARS was that it would just deplete, it would kind of exhaust ACE2. And that you can see in the depletion of ACE2 the foundation for many of the complications. The same is true for COVID-19. The depletion of ACE2 permits blood clotting, it permits excessive inflammation, it interferes with the function of the lungs and the kidneys. And one of the characteristics of COVID-19, which is underappreciated, is although this virus enters the body as if it were a respiratory infection, like the flu, really has a very high affinity for blood vessels. I mean, and there are researchers who have looked at this who have said, this is really a vascular disease, a disease of blood vessels. And that explains so much of what we see. In fact, back in, I think in March of 2020, when New York was just becoming the epicenter globally for the pandemic, I did a series of radio interviews at that time. And I also communicated with doctors in various parts of the country. And one of the radio hosts asked me something that I had heard, which is he was hearing rumors that people were really dying of heart disease, not of lung disease. And even if you get very sick with lung disease, it's the blood vessels in the lungs that are very strongly affected.
Well, Dr. William Lee, just to let everybody know, has actually done a lot of work. I know that you're very connected on this whole vascular issue. His group, he's made it very clear that there's even blood vessels not only damaged, but missing in some of these organs.
Right. I had a long talk with Dr. Lee about a mutual patient about 10 days ago. He and I absolutely see eye to eye. It was great talking with him. And what they were able to demonstrate was that there were loss of blood vessels in the lungs of people with COVID-19, and not only in people who were very sick, but in people with long COVID. And that some of the complications of long COVID are due to the loss of blood vessels. And I believe that has a lot to do with the loss of ACE2 and its downstream effects in the body. And if you look at what ACE2 does in a whole range of different conditions, it fits in perfectly. So
you have so back in 2000, when they first identified that this is a problem with the ACE2 and the other SARS, you, though, have taken it really much further and have really looked at this ACE2 and have done what I haven't seen anywhere else, and that's have important suggestions on how to help this ACE2 receptor become stronger again.
Right.
Because it's weak, it's inhibited, it's in trouble, basically.
Right. So my goal, thank you for that, because that is really the heart of the work that I've done with it. There was a lot of speculation that if you have more ACE2, you're more susceptible to the virus. It hasn't really been borne out. And in fact, measures that support an increased ACE2 are associated with better prognosis and better outcome. And the reason is that the level of ACE2 may be necessary for the virus to get into cells, but it's not really the determinant of who gets infected. The there is a backup enzyme called TMPRSS2. And the efficient entry of the virus into cells requires ACE2 and TMPRSS2. And TMPRSS2 really destroys ACE2. The attachment of the viral spike protein starts the process of destroying ACE2, at least in blood vessels. And that was demonstrated in work at Scripps. But TMPRSS2, which is only present in certain cells, like the lining of the nose, for example, along with ACE2, TMPRSS2 really enables the virus to get efficiently and quickly into your cells. It speeds up the rate of viral entry by about 100-fold. So the real problem is TMPRSS2, not ACE2, and finding ways to inhibit TMPRSS2 is worthwhile. Inhibition of ACE2 is a very dangerous process. You certainly, if you can find a way to inhibit the binding of the spike protein to ACE2, that's good. But if you start inhibiting ACE2 activity over a period of time, long term, especially in someone who's infected with the virus, that's probably bad. And so my protocol for prevention and treatment started with trying to amplify ACE2 activity. It's not necessarily the number of molecules, it's the activity of those molecules. And among the things that do it are, first of all, diet and lifestyle factors. Regular aerobic exercise, eating a diet that is high in polyphenols, in other words, a high fruit and vegetable diet. And there was a fascinating study done in 6 countries by researchers at Johns Hopkins, Columbia, Stanford, and they looked at health professionals, and they looked at the severity of COVID-19, and they looked at their diet in the year before COVID-19. And basically, a 40% increase in the consumption of vegetables produced a 70% decrease in the likelihood that someone would have severe COVID as opposed to mild COVID. Now, when a drug comes out with statistics like that, this is like going to save the world. It gets headlines all over the place. But this study by top researchers was pretty much buried.
And this is probably, the media is probably one of our greatest enemies in this whole thing. There's also a study from England called a Phyto-V study. And all they did was give the people in the study that they had controls that didn't get it, or they just got a blank capsule. But in the capsule was just powders, like fruits and vegetables dehydrated and put in a capsule, basically. They got that and a probiotic, and it had the people in the group that got that were, I don't remember the exact percentage, but significantly lower and very mild symptoms compared to the group that didn't get the placebo group that got just the empty capsule or whatever they had in it. So there's finally more and more people are starting to look at this and do studies. I was really glad to see somebody even bother to do a study because, you can't make money off of telling people to eat more fruits and vegetables. So you're not going to get that from the drug companies. But can you go back a little bit to the ACE2 and the TMPRSS2, where, so you said they're not together everywhere. Where are they together? Are they together in the brain and the lungs? Heart?
In the brain and some of the lung cells. The highest co-concentration is in the nose. And that's why the nose is such an important site of entry for this virus into the body, and why nasal sprays can be helpful at preventing infection. Of course, by the time you have long COVID, you're way past that. But they're also together in the intestines. And I'm glad that you mentioned the Phyto-V study and the probiotic, because there's a definite relationship between severity of COVID-19 and what happens in the gut. And in the gut, ACE2 has a very special function. It acts as a chaperone for the transport of amino acids into the body. The one that is most affected by the absence of ACE2 is tryptophan.
Oh
So
my gosh. Yeah.
you start damaging ACE2, you can get a disturbance in tryptophan uptake that impairs the immune system in the GI tract. It decreases the production of proteins like alpha defensins that are important for regulating infection in the gut and also for regulating the microbiome. And so as a result of COVID-19, there are long-term disturbances in the gut microbiome. Now, it is also likely, but not proven, that underlying disturbances in the microbiome impact how severe your infection will be. And many of the effects of let's say, the high fruit and vegetable diet in ameliorating COVID-19, some of them may be on ACE2 systemically, but some of it may be on basically the composition of the gut microbiome. Because the phytochemicals, the polyphenols, I think of them as curators of the microbiome. They regulate what kinds of organisms are going to be growing in your gut. And there is pretty good data suggesting that the microbiome plays an important role in how sick you're going to get. Now, when it comes to long COVID, that hasn't been looked at directly, but what we do know is that following COVID-19, that there are changes in the gut microbiome. This is probably due to many factors. It could be what you were treated with when you had COVID-19. It can also be the damage to ACE2 that's produced as a result of COVID-19. It may also be the persistence of the virus, because once this has been well established that the virus can persist for many weeks, and we don't know how long, after in the GI tract, after it's cleared from the respiratory system. So, I mean, that's what I mean about the different layers and the complexity.
Mm-hmm. And I just want to add, go back to the amino acid thing too, but also add, while we're talking about the gut and remaining, the virus remaining in the stool, I thought it was interesting. I'd never heard of this before until I read on your website that when, let's say that you're in a household and someone in the household has COVID, and therefore they have this virus in the stool, and everybody's sharing the same bathroom. So you had mentioned how important it is to actually put the toilet seat down and flush the toilet. And I thought, well, that is the first time I've heard that, but that's a really good tip, because people may not even think about that. That person goes back to their bedroom. They were in the bathroom. Now you come in and use the bathroom, and you are very much exposed. So I thought that's just a little off to the side tip that I thought was a great tip from you. But I wanted to talk more about these amino acids because, in the gut, people don't think of amino acids being important. And I'm particularly interested in the tryptophan one, but I know in a lot of children with autism, the tryptophan is going down another pathway called a chirinin pathway and causing quinolinic acid when there's inflammation in the body. Has anybody looked at that? Because
there's a little bit of work with that, and certainly in any situation in which there's gut inflammation, tryptophan tends to be diverted that way. Mm-hmm. And now kynurenine is the effects in the gut are very complicated of kynurenine.
We don't have to go into that.
Yeah.
But I was just curious. It started popping to my head when I started, when you mentioned tryptophan again, it popped in my head. So I just wanted to ask you that. But I also did want to say that fruits and vegetables, everybody says eat fruits and vegetables, but I don't think I wouldn't want them to run out and eat a lot of sweet fruits like bananas and mangoes and, the really sugary ones, because there are issues going on in the gut. You are feeding pathogenic bacteria in the gut. So I think when we say that fruits and vegetables are good, it's important to clarify that you want low sugar. Even in vegetables, if you bake a sweet potato, it gets very sweet. And if you grate it up and eat it raw in a salad, it's not sweet at all. So I just wanted to throw that in as something I never hear anybody talking about. But back to the amino acids, they're even important for healing the gut, right? So would you recommend people actually take a amino acid supplement?
Not necessarily. That's not at the top of my list.
Mhm.
Just to run through so the first thing that I think of in terms of, okay, how do we protect from the effects of this is let's enhance ACE2 activity. And by the way, that Hopkins study, it was the vegetables that made the difference. It wasn't the fruits.
I'm
Okay.
glad you clarified that. It's important.
It was the vegetables. So, so the supplements, let's say your gut is so wrecked by having had COVID-19, you can't eat the right diet.
Because you get diarrhea. You mean every time
whatever.
you eat something, it goes right through you, for example?
Right, or you have abdominal pain. So there is a particular probiotic that I've been using for people who have COVID-19. It comes from Siberia, actually, and it was developed in about 40 or 50 years ago there. It's a soil-derived organism that releases alpha interferon. And alpha interferon is a protein normally made in your body. The virus that causes COVID-19 is extremely sensitive to alpha interferon, and it's readily killed by it. But it has figured out how to turn off your production of alpha interferon. And loads of studies have shown that alpha interferon protects against COVID-19, and those people who get sickest are those who are unable to make it because of things that the virus does to you, not necessarily because your immune system is weak to begin with, but the way in which the virus plays with it and fools it, and hides from it or inactivates the interferon signaling. This is a probiotic that I certainly have given to everyone who had GI symptoms, either associated with COVID-19 or long haul, let's say post-recovery symptoms. Works great for diarrhea. It's called Tundrex, Tundrex. It's available in the US now. A short course of it. It's not a long-term treatment,
Well, is that subtilis, for example, you find Bacillus subtilis in natto? Is it a different special strain that you're recommending?
It's a special strain of Bacillus subtilis, and one that actually was developed in order to produce alpha interferon. It was developed by Soviet scientists to protect their troops in Afghanistan. And I first became aware of it and started using it through an interaction with a patient of mine, a US serviceman who had gotten sick in Afghanistan and had not recovered. And he came to see me to try and heal his gut. And he had a colleague who was a Russian physicist who had emigrated to the US who told him about this product. And so he tried it. It was really helpful. They got interested in trying to make it available to other people. They got me a whole bunch of samples. And about 3 or 4 years ago, I started using it specifically with patients who had been treated for intestinal parasites and other pathogens and had not gotten better, or they were still really struggling. And I found that it had a significant impact. So I was frankly excited to try it out in the context of COVID-19. It just made sense to me. And I've seen it really help with the GI symptoms of people who've had COVID or who were trying to recover from COVID. And then I had a conversation with an immunologist at UCLA maybe a few weeks ago. A patient of mine someone who was consulting me for long COVID. And one of the things I want to say, by the way, is in terms of patients who have followed my COVID protocol, who are under my care, the incidence of long COVID has been really low in that group, maybe 2% compared to like 30% in terms of what's reported in the general population. So
that's really important for people to hear that, because I think maybe we're gonna get COVID. I haven't gotten it myself that I know of, but maybe I'm gonna get it. But the scarier thing is you get over it, but it's what happens afterwards, maybe for
Right.
years or the rest of your life. So you want to prevent long COVID, which is why this interview is so important in all of your research, everything you figured out from years of working with people. I hope everybody heard that. But with the Tundrix, people should start on it now, not wait until they get the virus and become a long hauler, because you want the bacteria subtilis, Bacillus subtilis is what it is, to build up in the gut. Right?
Well, the way that I'm
agree?
using it, I'm not using it for prevention, because I don't want people to stay on it for months
Oh, okay.
or, a year. If you get COVID, I'm recommending to my patients that anyone who gets COVID takes it. And I'm putting the long COVID patients on it for a short while, even if they don't have COVID-19, because of this conversation I had with an immunologist at UCLA. As I was saying, somebody had contacted me with a severe case of long COVID, and she had actually gotten over it and then got some other virus, and it flared up again. And she said that she'd consulted this immunologist, who said that her belief was that the virus lingers in the GI tract, and then there's another viral infection or some other stress, and it reactivates. So from that perspective, it made sense to me. Let's just try and get this virus out of here. And there are no antiviral drugs that I know are going to work. So let's use a very safe, well-tested probiotic for a short period of time, 2 to 4 weeks, just to establish a foundation. And the other aspect of the foundation are supplements that increase activity of ACE2. Number one, vitamin D. And of course, there's a lot of literature on the beneficial effects of vitamin D in the pandemic. Number two is curcumin, which is extracted from turmeric. And there actually have been clinical trials with curcumin in the treatment of acute COVID-19, which have shown in hospitalized patients really significant effects, as strong as any drug, better than remdesivir, for example.
Well, could you use both of these as preventative? Should you be
Yes.
on them before? And also dosage. People are going to want to know how much per day.
Right. The dose of curcumin I'm recommending, it may depend on the form that you use, but 1,000 milligrams a day, roughly.
Divided?
Yeah, usually twice a day with food. And there are forms of curcumin that are either liposomal or nano, mostly liposomal forms that enhance the delivery to tissues. So I'm basically recommending a liposomal curcumin in the range of, for treatment, certainly 1,000 milligrams a day. For prevention, over a long period of time, maybe 500. It does get concentrated in tissues. It stores up in the body. And resveratrol. And the dose of resveratrol that I'm recommending is 600 to 1,200 milligrams a day, both for prevention and treatment. And resveratrol.
Would you repeat all that? Like the vitamin D, resveratrol, curcumin, and there's one more.
Well, those are the three basic ones. There are a lot of others that may be useful. One of the others is rosmarinic acid, which is found in a number of herbs and spices, and certain vegetables, and that also enhances ACE2 activity. So vitamin D at a dose typically 2,000 to 5,000 units a day, taken with your main meal, because it's absorbed best with your largest meal. I want a blood level
fat soluble, 50. Some fat in the meal.
Yeah, there needs to be some fat in the meal. And it can be with vitamin K. I often like that combination of K2 and D3. And there was a study indicating that people with low vitamin K get sicker when they have COVID, when they're hospitalized with COVID-19. Curcumin as a liposomal product, 500 to 1,000 milligrams a day. If you're sick, higher doses. Resveratrol, it could be liposomal if you can get it that way. There's a liquid that I give to kids, liposomal curcumin and resveratrol. But even if it's not, it is well absorbed. And the longer you're on these, the better, because only small amounts of active product actually get to your tissues, but they stay there. And then if someone is sick, I will definitely push those. And I've seen some really impressive responses. And as I said, I've seen for curcumin randomized controlled trials from India and Iran showing significant benefits for people who actually have COVID-19.
Now, I want to stress too that children need vitamin D in particular. Even a newborn baby, they recommend 1,000 milligrams. But there's some genes, like the transporter genes, for example, that don't get vitamin D into the cell. So I know the person most likely doesn't know that, but I have seen, had people tell me that they got their vitamin D tested and they're taking it and it's not going up. So increasing to that healthy range where you want your test to say at least over 50, 60 or so. And so I wondered about this for a long time. And then when I found out about vitamin D genes and the transporter genes in particular, it made me think that this recommendation to take vitamin D really kind of needs to be ideally personalized. People need more.
Certainly the dose needs to be personalized. One of the effects of resveratrol increases the sensitivity of the vitamin D receptor. So you don't necessarily need as much vitamin D to get the same effect if you're also taking resveratrol.
Sorry, I keep interrupting you. Also, vitamin A needs to be, to me, vitamin A and D go together because in food, like egg yolks, for example, and cod liver oil and so on. When you find D, you find A together. And, I've heard Chris Mestergen, for example, has a lot of research on this, a lot of teaching about it. So I also tell people that they want to take A and D foods too. So I don't know if you disagree.
I check the vitamin A level on almost all of my patients. The one concern about vitamin A is there's a potential for liver toxicity if you take too much. But low vitamin A levels definitely associated with increased susceptibility to viral infection, immune impairment, and worse outcomes with COVID-19. So there may be some value to using A along with D. Now,
I'd like to see more research done on that because quite a while ago I read some research on how vitamin A is missing when someone has a lung infection that's persistent, like a cough that goes on and on and on, and then going for a short period of time on a higher dose of vitamin A, the person got over that pretty fast. So I wish there's so much to research on this, but I just, thanks for saying that. And I cut you off about the resveratrol. That's what people know as being an anti-aging molecule that's in wine, but it has other value too. Could you mention a little bit more about resveratrol?
Sure. Resveratrol is anti-inflammatory, and its effects on ACE2 are actually really clinically meaningful. That is, this is mostly through animal studies, but the effects of giving resveratrol to laboratory animals, when you look at the blood vessels, for example, is very much the same effect, the same protective effects that you get from ACE2. That is, it prevents aneurysms in the aorta. And so I think it's very likely that the enhancement of ACE2 activity that's caused by resveratrol is not just some number in a laboratory, that it actually is meaningful in terms of health outcomes. And one of the other things that resveratrol does, separate from COVID-19, it decreases the production of a toxic substance by gut bacteria.
Wow.
And this is a whole other area. There is a substance called TMAO, trimethylamine oxide. It's gotten a lot of press in certain circles because of research at the Cleveland Clinic, which found that elevated TMAO was associated with heart attacks and with strokes. TMAO is toxic to blood vessels. It increases blood clotting. And the bacterial population of your gut produces the precursor of TMAO, which is TMA. And TMA in your liver is turned into TMAO. Resveratrol inhibits the production of TMA by gut bacteria. So, and it is now possible to commercially test for TMAO levels. Quest does that test. I ordered that in a lot of my patients. And 99% of the time, if it's elevated, without changing their diet, if you put them on resveratrol,
that's amazing.
Down. And the issue with diet is some people need to eat a high protein diet, and it's the high protein foods that are the precursors of TMA. So resveratrol is helpful there.
Well, is it because, when that first came out, I thought, wow, this is not good for people that are on a high protein diet, or just on protein, period. It doesn't even have to be high protein because people need it. And so, but then, I have an advanced fellowship from A4M and took a bunch of other modules and everything. And I remember that coming up because that's when it was announced to the world. And it was like, oh no, what do we do? Carnitine is supposed to be bad, and yet you need carnitine for getting fat into your cells and so on. And so, but it looks like from when I started really digging into it, it really has to do with a dysbiotic gut, like bad bacteria in the gut are causing that, where if you have a healthy gut, I personally am a big fan of fermented vegetables, which I'd like to talk about a little bit. And so you've got all these incredible beneficial bacteria that are gonna, even if you're eating the protein, at that together, which I do all the time, that's a great way to deal with that, how to deal with the TMAO problem. It's not that big of a problem to me, but I'm glad you brought it up. And it's interesting you test for it.
Yeah, well, definitely. The TMAO is a reflection of gut dysbiosis, and resveratrol can be part of the solution to that dysbiosis. Resveratrol has a number of other effects on bacteria. It decreases the production of staph toxins. It's a multi-purpose protective substance that I find useful in many different clinical situations. And I was never excited about it for anti-aging. The best anti-aging is the healthy diet and exercise. I'm not big on supplements for anti-aging. I think I see that as a lifestyle issue. But resveratrol has a lot of different functions that are useful. So when it comes to long COVID, my first approach is let's do the Bacillus subtilis tundrix to make sure that we've dealt with the virus in the gut as well as we can. Let's make sure that vitamin D, curcumin, and resveratrol, if they're tolerated, not everybody can take them. Some people might get an upset stomach or heartburn or something else from supplements, but let's make sure that's part of the therapeutic cocktail to enhance ACE2 activity. And then I start looking beyond that. One question that I had, which may have been answered from research that came out of the University of Arkansas a few weeks ago, after I posted a video about this on YouTube in June. It reflected all of my research over like 18 months on COVID-19 and about a year's research into long COVID, since that started to be looked at more. And I tried to, it's about an hour-long video that tries to put that in a form that's useful to people. It's called Healing Long COVID. one of the questions that I couldn't really quite figure out is, why is it that some people don't get very sick with COVID, but then they get long COVID, and yet the manifestations of long COVID often involve ACE2 deficit? So what is happening? Why do they get through COVID so easily and then get hit so hard a few weeks later with long COVID? And one of the things that happens with COVID-19 is there is a very high rate of production of autoantibodies. That is the immune response to COVID-19, as you know, that creates kind of, it's like the smoke from the fire. It creates a lot of autoantibodies that are directed against your own tissues. And many of these are functional, and a lot of the complications, especially with long COVID, may be due to autoantibodies. Well, a group from the University of Arkansas demonstrated that about 70% of people with COVID wind up making antibodies to ACE2, autoantibodies to ACE2. And the creation of these autoantibodies seems to correlate with the creation of the spike proteins, of the spike protein antibodies. And so they invoked an explanation for this that's very complicated, but I'll try to make it clear. When you make an antibody to something, let's say you make an antibody to the spike protein, that antibody can serve as an antigen for another antibody. In other words, you can get an antibody that is directed against some component of the first antibody that you made. And these antibodies, which are called anti-idiotypic antibodies, are actually thought to be mostly protective, but not always. And then you can get antibodies to the next antibody. And it's kind of like if you're holding up two mirrors, one in each hand, you can angle the mirror so that there's this endless series of mirrors, one inside the other. It's kind of the same phenomenon. These are called immune networks. And they're a little bit chaotic, just as the endless series of mirrors might be. So they may be protective, but they may be harmful. And these researchers, one of the observations that's been made is that some people with COVID-19, long haulers, get better after immunization, after the vaccine. And I mean, I've seen that in about, half a dozen patients who dramatic improvement in their long haul symptoms within a few days of getting one of the COVID vaccines. How do we explain that? Well, the impact of that on these immune networks and the way that might balance the immune networks, that would be an explanation. Now, I've seen almost as many people who got really sick after the vaccine, that is, long haulers who then got vaccinated. And I think it just has to do with the chaotic nature of this system. If you're actually increasing these components in these immune networks, the anti-idiotypic antibody, the mirror within a mirror phenomenon, yeah, maybe it's going to help, maybe it's going to hurt. So I looked for ways to try and
ask you that.
Deal with this.
What do we do for that? That's really an important finding.
Right. What would be helpful? Now, in conventional medicine, this phenomenon is known and does occur in certain autoimmune diseases. It's treated with intravenous gamma globulin. Well, that's a pretty invasive treatment, so it's not at the top of my list for ways to improve that. And also high doses of steroids are used, also not at the top of my list. I spoke to some really top immunologists about it. Nobody really had a clue. So what I came up with were proteolytic enzymes. Proteolytic enzyme therapy has been used to combat inflammation. The one that's been around the longest are WOB enzymes from Germany, and they're the ones I've kind of used the most. You have to take them on an empty stomach because you don't want them digesting food. You want them, if you take them on an empty stomach with a large glass of water, they actually are absorbed systemically. But you could maybe use nattokinase or serrapeptase or one of the other proteolytic enzymes. I just have had the best results historically using WOB enzymes. So that's what I've been advocating. And
Once I learned that, just read that the other day from you. We have digestive enzymes that are pancreatin with all those enzymes. And so I started taking 3 times a day because that's what Nicholas Gonzalez did in his pancreatic cancer program. And it's kind of forgotten. And so I thought that was brilliant that you brought that back out. And this is so important. One of the questions I was going to ask you is long haulers, the new autoimmune condition. And you're basically explaining, yes, it is, but it's really even maybe more complicated than the normal autoimmune condition. So I'm hoping that people replay this part of our talk. And I am 100% certain that even your brightest, best functional medicine doctors do not know this. So it's important to get it out. I'm very grateful that you're taking the time for us to talk here. But this, what you're just saying right now, is super important, I think. And hopefully people will hear it again. Go ahead. I'm sorry. I keep interrupting you.
So I am using, certainly in anybody in whom it seems to me that ACE2 deficiency is what's ongoing, I am starting to work with WOB enzymes. The idea is to break up these immune networks and antigen-antibody complexes.
How much to take of that, though? Because I just know from the Gonzalez.
3 to 5 pills. I've been using it twice a day. It could be 3 times, but it needs to be on an empty stomach with a large glass of water.
And it isn't harmful to take more. It's not going to hurt you, do you think?
Well, the only concern is some people, proteases are pretty strong. And so if you have inflammation in your stomach, the proteases might aggravate it. So I'm very
So if you had like an ulcer, you're saying?
An ulcer, right. People who've had ulcers, and I don't put them on, or gastritis. I'm extremely cautious about putting any of them on proteolytic enzymes.
And HCl too, right?
And also, sure. Sometimes they benefit, but it has to be done under careful supervision. This is not something to do yourself. Now, the next layer looks at, okay, what's going on in this person? Is there evidence of neuropathy? Is there evidence to suggest mitochondrial dysfunction?
Next question was about that. This is perfect. Because everybody will identify with this, because when people start to feel sick, from everything I've read, it's about a day and a half when the virus is actually replicating inside of you before you start to feel the first symptoms, which is usually fatigue. And the long haulers have a huge problem with fatigue. So I wanted you to, if you would, go more into the mitochondria. Are they're damaged by the virus?
What's been demonstrated, actually, there is mitochondrial distress that has been seen after recovery from COVID-19. And the damage to ACE2 has been shown to produce mitochondrial distress. This was in a study, this was in a study from Scripps, actually. And in a study from the UK, there was evidence that just people who were recovering from COVID-19, if you looked at their blood, they had evidence of mitochondrial distress. The mitochondria had taken a hit and were trying to recover. So there are a number of different mitochondrial recovery programs. In looking through the literature of clinical trials that are placebo-controlled, high quality, the number one substance that comes up is coenzyme Q10. Coenzyme Q10 has the best track record for mitochondrial rescue of any supplement. You need a high dose. You need 300, 400 milligrams a day, and you need to take it spread out through the day. 100 milligrams won't work.
Do you like the form ubiquinol?
Yes, Generally, you need a little bit less ubiquinol if you're using that form than ubiquinone, and that is the form that I use. So, aside from that, beyond that, there are a number of other things that may be helpful for mitochondrial recovery. Carnitine in its different forms, acetylcarnitine or propionyl L-carnitine, niacin, especially combined with NAC, supports and drives mitochondrial complex 1, assuming that the mitochondria have several enzyme complexes that are involved in generating energy. So glutathione is very protective of mitochondrial complex 1. And I think some of the benefits that people get from oral or intravenous glutathione is due to that.
And in this NAC, let's say you can't get glutathione, you can't afford it, or you can't go to get IV glutathione. Do you think NAC, the precursor to glutathione, is okay?
NAC is a really good choice. And the combination of niacin and NAC has been shown to support that function.
And how about magnesium?
Magnesium is important across the board for energy production. And so, yeah, I always look at magnesium status in everyone I'm treating.
And B vitamins, alpha lipoic acid, do you use any of those?
Yeah. So I use, I'm using the alpha lipoic acid mostly for the nervous system, and I use it for two purposes. One, because alpha lipoic acid actually helps the recovery of ACE2 activity in the brain. So anyone, and it's useful for the treatment of peripheral neuropathies. So anyone who has a neuropathy as a result of COVID-19, including the POTS syndrome, I will go to alpha lipoic acid, often combined with essential fatty acids. If we're looking at peripheral neuropathies, GLA has been shown to be synergistic with alpha lipoic acid in the brain for cognitive function. The omega-3s and alpha lipoic acid are synergistic.
Like when you say GLA, you mean like borage oil?
Borage oil, yeah, or evening primrose oil.
Yeah.
And there, the dose for alpha lipoic acid in the peripheral nerves is about 600 milligrams a day. The GLA, about 450 milligrams a day. I may combine that with B vitamins, sometimes even with NAC, and lion's mane, which is a mushroom, has neuroprotective effects, and both for peripheral nerves and for the brain. So, but for cognitive function, I'll particularly push the omega-3s, 2,000 milligrams a day of EPA plus DHA, that combination. Not 2,000 a day of total omega-3s, but 2,000 a day of those particular omega-3s.
Well, we didn't talk about the gut-brain connection. We haven't talked too much about the brain, but memory loss is one of the scariest, most frustrating things I think people deal with when they're long haulers. Can we talk about the brain and the gut brain and any of that?
Well, there's this amazing.
Why the brain? Does the brain have ACE2 receptors? How does the brain get into the picture of long haulers?
We'd spend an hour talking about that, but just briefly, butyrate produced by gut microbial fermentation. The microbes produce butyrate by fermenting fiber, and you may get it from fermented foods, which I know are your favorites. Butyrate is absorbed systemically, and it gets into the brain. And in the brain, butyrate increases the production of a substance called BDNF, or brain-derived neurotrophic factor, which plays a really important role in the recovery from injury. And this virus, the SARS-CoV-2 virus, gets into the brain. It kills nerve cells. It creates inflammation in the brain. It interferes with the circulation in the brain. So you need recovery of brain cells. BDNF is very important. Butyrate from a healthy gut microbiome, or by prebiotic supplementation or supplementation with butyrate itself, can play an important role.
There are two companies. Body Bio has a butyrate supplement, and also the Tesseract company has one too. So, again, some people, they're not going to heal their gut right away, and they maybe need the sodium butyrate right away.
The important thing here is you don't necessarily need a delayed release butyrate to get to the colon. If you're trying to heal the colon, you want a butyrate that's going to get there. But since you're trying to heal the brain with butyrate, you could use sodium butyrate. It doesn't have to be a special preparation. It's fine if it's absorbed in the small bowel. You want it to get, you want it to get into the circulation and up to the brain.
Are you
But
referring to like tributyrate, which is in the, supposed to be the butyrate that gets down into the colon? That's good to know.
Right,
So
but you don't.
It's
You don't
okay
have
to take a normal.
You don't have to go with a more expensive product like that to get butyrate to your brain. And you can use fiber, and you can use prebiotics, and fermented.
And by the way, fermented foods have all of that.
Yes,
I'd like to talk about diet, but one more really quick question, because I know we're running out of time. Testing. Do you have a certain group of tests that you have all your long haulers absolutely positively do, like vitamin D, for example, homocysteine, anything like that?
Oh, sure. I mean, I look at all of the things in long haulers that I would look at in, in any sick patient that's coming to see me. I'll definitely look at vitamin D, magnesium, selenium, homocysteine,
Because that could be a factor for the heart, why people are, getting a heart problem. Their homocysteine methionine cycle could be off, and
right, and it's a good
index
of folate and folate status. And I might look at methylmalonic acid as an index of B12 status. I might measure coenzyme Q10, or just assume that it's off. I'll often look at urine organic acids, because that tells me a lot of information about how mitochondria are performing. I will do stool tests. One of the characteristics, because I want to see what's the balance of bacteria like. Is there a yeast overgrowth? Yeast overgrowth is a complication of COVID-19.
Why do you think that is? That's so important. I suspected that, and then I absolutely read it on your site, and I was so excited. Why? Because what I'm thinking is, people come along and they say, I was perfectly healthy, then I got COVID. I didn't get a bad case, but now I'm really sick. And I'm thinking, were you really healthy? People have this, people tell me all the time, oh, I'm on a healthy diet. And then I ask them what they're eating, and they're not at all. Or I am healthy, and yet they get reoccurring yeast infections, herpes outbreaks, gut dysbiosis, that they're not putting in that pot that says they're saying I'm healthy, and they're not really healthy. And I'm wondering if the virus just doesn't kind of reactivate everything. So what you said about how it reactivates yeast, I think, is an important clue.
Oh, it certainly can, just like any other virus, actually. That I don't think is one of the unique features of COVID-19. There are unique features to COVID, but like any other virus, it can reactivate underlying problems. And I totally agree with you that I see patients who say, I didn't have any medical problems. When you start really talking to them, they actually had a lot of medical problems, some of which they were even treating with drugs, but they never thought that meant that, that they had a problem. But I have seen people that I think were really healthy prior to COVID. And I try to figure out what are the mechanisms, what was going on here. In one case, there probably was an underlying omega-3 deficiency for years. It just the stress test hadn't been done. COVID is a stress test.
Right.
And so maybe you're going along and you're doing fine till you get the COVID stress. And for other people, there may be something genetic that wasn't being
nobody seems to be looking at that quite yet. But for sure, the immune system is suppressed. It's overwhelmed trying to deal with a virus. It can let other things out too, like Epstein-Barr herpes, which so many people have anyway. And so I feel like, that's not coming out enough, is that you're reactivating things. And that didn't seem to be a problem.
There was one study that looked at antibodies to Epstein-Barr virus in people with long COVID and a control population. And that 75-80% of the population with long COVID had an antibody profile that would suggest reactivation of EBV. Now, that was one study. It was maybe 30 people. That hasn't been my experience, but it certainly is something that can occur. The yeast overgrowth, I think, is due to the dysbiosis, the bacterial dysbiosis that occurs. some of which is the result of the ACE2 deficit in the gut and the impaired immune response. And then there are the drugs that people get. You know, I mean, especially early in the pandemic, there were a lot of antibiotics being thrown around, and that will aggravate the dysbiosis of COVID-19.
So the yeast infection is more in the gut versus the systemically in the blood.
Well, they just demonstrated that there was an increased growth of fungi, okay, including not only Candida albicans, but Candida auris, which is a really scary pathogenic yeast. So, so I will test stool looking for yeast. I will test stool looking for the balance of gut bacteria. Certain bacteria seem to be associated with a worse outcome. Enterococcus fecalis, which is a major stimulator of gamma interferon and sometimes used as a probiotic, actually makes things worse with COVID-19. Faecalibacterium prausnitzii, which is an anti-inflammatory butyrate-producing bacterium, and one of the keystone species in the microbiome, seems to make things better.
Can I add right here? Literally have an entire folder right here of lactobacillus, fermented foods, even a study not done too long ago, Japanese. They have a pickle or fermented turnip over there, and the lactobacillus, it's the brevis. You know, they isolated it and they gave it to school children, and they didn't get the flu. So this is just the flu, but there's no doubt. I mean, I have a lot of research. I want to present this more to the world, how important these fermented foods are preventive, you know, to prevent, create a healthy gut. Do you recommend fermented vegetables? They're the best, really.
Fermented vegetables can be really useful. I recommend them to some people. I have so many patients with food intolerances that I have to really, it's like picking your way through a minefield, making dietary recommendations.
That makes sense. Well, thank you so much. The information that you shared is, first of all, really needs to get out in the world. So I appreciate you taking the time to talk to us, all of us, and I'm going to do my best to get this information out. But I want everybody to go to drgalland.com and keep up on whatever else Dr. Galland is going to dig up here for us. Obviously, he's not going to quit until we have this great understanding of this long haulers and COVID situation. So Dr. Galland, thank you very much.
Thanks for speaking with me today, Donna. It was a pleasure. Bye.
Bye.